Today's podcast discusses the topics of mental health and suicide. We know these conversations can be challenging and affect people in different ways. If this is not an appropriate time for you to listen to this episode, or at some point you are affected during the conversation, we encourage you to take a step back and talk to someone you trust. You can also call the mates on 0800 111 315 for immediate support. So that number, 0800 111 315. Welcome along to the Master Builders Elevate podcast. Excited to have the team from Mates in Construction joining us on the podcast today, tackling such a challenging topic in our industry, being mental health. I wonder if we could start off by having you guys introduce yourself. Maybe Dr. Lauren Donnan, can we start with you?
Hi, it's so lovely to be here and have this opportunity to present what we do at Mates in Construction, and for me, the research portion. I've been at Mates around 6 or 7 months now, and my role is looking at the research and evaluation portion of our program. And that's all about making sure that our workers' voices regarding their stresses and the issues they're facing are shaping everything that we do. So it's an awesome role. I'm absolutely loving being part of this team and the Mates model, where we go out on the ground, make sure we spread that awareness and upskill workers to be able to support one another. So thank you so much for having me on the podcast.
So welcome, Lauren. Great to have you here. And maybe can you give us a bit of intel? Why was Mates in Construction an interesting organisation for you to join?
I think just the opportunity to work somewhere where the research that I do has that immediate on-the-ground impact. So being able to hear the need, see what's going on, that high suicide rates in the construction industry, access worker voice and understand what's going on for them, and using that directly through field officers going out and doing the trainings and upskilling workers and speaking to those key issues. It's just incredibly rewarding to see that transition from research to immediate on-the-ground action, which is fantastic.
I love that. Thank you. And a nice segue, talking about the field officers, because we have one of Mates in Construction's most experienced field officers with us on the podcast today as well. James Sendall, welcome along to the podcast. Can you give us a bit of background on you and your role?
Okay. As you said, one of the more experienced field officers in Mates currently, coming up to my third season now. We're in the Mates jersey, and throughout my time, it's been an absolute pleasure, and as Lauren kind of perfectly put it, it's been hugely rewarding for me. Prior to this role with Mates, I did have an industry background working within trade sales. I worked in a trade sales store on Great South Road in Penrose, and I really enjoyed the people who would come into my store, the people who were working on the jobs that I now interact with. And so this opportunity to work with Mates completely aligned with where I saw my journey heading, and my journey so far throughout Mates, coming up to the end of that third season, walking into my fourth, will be absolutely gargantuan, to put a nice word to it. I've loved to see the progress of our organisation since my starting point in 2021 to where we are now. We've grown nationwide from a small little team in an office in Albert Street to where we are now sitting here today recording this podcast. It's been amazing.
Right. Thanks, James. And you guys have done an incredible job of creating awareness in the construction industry. But maybe for that one person listening to the podcast that is like, who are these Mates in Construction? Are these guys that I just go for a beer with on a Friday? Could you give us a bit of clarity around what it is that Mates in Construction does?
Oh, absolutely. I think it's very apt, because whilst many do know, it was all about awareness at the end of the day, and that's our first step. And I always like to put a little caveat in before I start discussing our program, is that we absolutely love our industry, even though we talk and make it very clear that our industry is the worst industry in terms of suicide out of any industry. We absolutely love being in this space. We love being our boots on the ground. That's where our awareness is generated through the first step of our program. And that step is called our general awareness training, delivered on-site, usually 45 to 60 minutes, with a PowerPoint presentation screen in front of an audience of usually 20 plus. If it is a smaller residential site or there's a numbers less than 15, we deliver what's called a Mates awareness training, a more casual, spoken word conversation to those who are present on site, usually first thing in the morning at a pre-start or a toolbox tool. A condensed version of that general awareness training that encompasses not only where we're sitting, that state of play, what the numbers look like in terms of suicide in our industry and within our community here in Aotearoa, but also what to look out for in the ones beside us and ourselves. A key term here that we cover in that awareness training is the concept of invitations, the ways in which people may show us in less than clear means that they are struggling or are doing it tough with the many stresses and pressures that do exist around within our industry and outside of at the moment.
Thank you. Is this training, is it for people that are actually construction practitioners, like they're literally on the hammer, or is this for business owners, or is it for kind of everyone in between? Who does it cater to?
Yeah, that's an absolutely amazing question, right? I think everyone that you just mentioned, it is for the owners of those businesses, it is for the management of those businesses, it is for those on the ground, it's for everyone in between. I think awareness is absolutely mandatory, really, for our program to succeed. And for us to be able to deliver this training, buy-in does need to come from the top down. So it is training absolutely for everyone, where I always like to say when we're on site, where as a field officer, I'm no one special, just an everyday person trying to make a difference every day. And all those roles that you mentioned are also everyday people trying to make that difference. So that buy-in and that training does need to be delivered throughout all those roles. Every person who's engaged in the construction process, from suppliers to project managers to planners, quantity surveyors, every part of our industry, which is very wide, it's a really large umbrella, does need to be on board to make this difference, to start to change these numbers.
Thanks, James. Lauren, I'm going to come to you to learn some more about the research in just a moment, but I just have one more question for James. Mental health has a significant spectrum. There might be some early signs. There might be people that are doing it really, really tough and need some intervention straight away. I'm sure there's some like post-care things that need to happen once someone's maybe dealt with the core of the challenge they're facing, but it's going to be an ongoing. How does Mates in Construction think about kind of the different phases, and where is it that Mates in Construction fits in those different phases?
In terms of the different stages, once that awareness is generated in that first step, what we aim to do is then to train at least one connected trained person per 20 workers on that site. What I mean by a connector is the second stage of our training, which you can volunteer for at the end of our general awareness training. Those connectors promote alertness within their work environment. They are trained within 4 hours to have a framework of conversation to not only notice some of those invitations, but also keep adhering to the tenets taught of clearness, directness, and honesty around asking a question around if someone is having potential suicidal thoughts, to clarify whether that person is or is not thinking about suicide at that point. If they are or aren't, how to connect that person to help or support that they might need right then and there. For if suicide is not necessarily on that table at that point and that question has been asked, support can still be delivered. It might just be a conversation that does need to be had right then and there. But if it is a crisis situation, that's where the third step of our training comes in, which is what we call ASSIST, Applied Suicide Intervention Skills Training, which is for those moments that you mentioned, those crisis moments where an intervention does need to be made, and our connectors can volunteer to go through ASSIST training at the end of the connector course. And for those moments that I describe, it's a bit like a metaphorical bridge, if you will. If someone is in that crisis moment, an ASSIST trained person over a 2-day period is taught the confidence and the framework of conversation to not solve or fix what that individual is going through right then and there, but simply just to keep them safe for now, to step down from that bridge and talk, to connect them to the support or service right then and there that they might need just to get them back to where they need to be, establish a plan of safety. But if there is interventions needed, that's where an ASSIST is at its most valuable. We aim usually for one ASSIST trained person per site that we interact with, but ideally 2 or 3. If someone is sick or someone else needs to be called, we like to have a network so that our program always has someone that they can lean upon, whether on site, within office, within branch of the supplier, wherever that may be. This network can be grown, and this community approach that we're implicating here, we're trying to promote, can be widespread. And that's a key part of really what we're trying to do here at Mates is developing that at a community level as well as an industry level throughout our partners, much like master builders, who allow us to be able to get in front of the people we need to, and to be very extremely multifaceted in the way that we apply this, so that this message that I'm even speaking about right now in our program and a way of interacting becomes really what we do in our industry, much like your forklift training or your site safe. It becomes a part of what we do, not a confronting or tough subject, but even though it is everyone's business at the end of the day. So in terms of programs and initiatives across this continuum, so the promotion of wellbeing is extremely important for us. How wellbeing informs how someone is going to be dealing with stresses or how we're going to notice if they are potentially struggling. So even what we're doing right now ties into that, promoting our message, promoting our Cope Up, promoting our program, and especially what my extremely talented colleague sitting across from me practices within her department, within research. We are able to report and display our findings, display our effectiveness to drive ourselves forward in an informed manner. But also when you look at prevention, very key to what we do is igniting hope. I mentioned before about this being a tough subject, but this being something that is often difficult to discuss, and flipping that narrative and changing it over time to be one of positivity and igniting hope is extremely key to that we can ignite hope through others, to ourselves, but also know where to go if someone is at that crisis point, if they do need help or they do need support. That support is available to them. If someone is potentially displaying suicidal behaviour, they have mentioned potential suicidal thoughts, as where intervention can be a step that is made by those who we do train within our program, those connected trained individuals or assist trained people, or even through ourselves here at Mates interacting with our case management team. Or I like to call them guides or Sherpas along that sort of pathway to help those who might just need a check-up over time, not delivered to support or to services, but guided along that path to make it that much easier. And with all of these steps, I did touch on it a little bit, but all of these steps, promotion of wellbeing, prevention, intervention and postvention, what is really our foundation is our research, really, isn't it? It's really what underpins everything that we do. And I did mention, and I'll repeat myself, but if we cannot report what we're doing or how the industry is faring or essentially what is going on, it's almost as important as doing it in the first place.
Thanks, James. And maybe a great segue to come back to you, Lauren. Could you tell us more about the research you've done and how you're finding it to be more effective and what impact it's having?
Yeah, absolutely. So like James said, the research is about understanding how our workers are travelling in terms of their wellbeing and mental health, those key stresses, and how we can make sure that our program is really targeting those key stresses. It's also about understanding the impact that we're having. So when we go out to sites and we do those trainings that James mentioned, how do we know that there are positive shifts happening? Are workers becoming more open to talking about mental health? Are our connected trained workers comfortable asking the question, are you having thoughts about suicide? So that evaluation component is really important as well. And if we see there's areas perhaps that there's barriers in applying that learning on the work site, then we can change what we're doing to make sure that it's as effective as possible. And the research runs that whole gambit of promotion, prevention, intervention and postvention. And coming to Mates, I think I didn't come from a mental health and suicide prevention background. I came with my research, policy, advocacy expertise. And it's been incredible just understanding that Mates, I think everyone's quite familiar with the ambulance at the bottom of the cliff analogy. And Mates is just so far back from that cliff to start that promotion, that understanding, changing a whole culture of it's absolutely okay to talk about mental health, to not be okay and tell someone or identify that someone's not travelling well. And so the research looks at each of those points. For example, if there was a critical incident on site, so that's that postvention, Mates comes to that site, supports the site, makes sure that the workers have the support they need following an incident happening. And how's that being received by workers? How can we do that to the best of our ability? So the research really is the foundation to tell us what to do based on research that's been carried out outside of New Zealand, but also from our workers. And it also tells us how we're doing, which is really crucial.
And I understand you did a significant undertaking in the research perspective, running a wellbeing survey. Do you recall how many people did you have participate in that survey?
We got the most participants we've had. So this is our third Mates Industry Wellbeing Survey. We got over 2,000 workers sharing with us how their mental health is right now. What are those key stresses at work and home that are contributing to poor mental health or making their life a little bit tough at the moment, and how they have interacted with Mates and found the Mates program. We talked about kind of the diversity of our industry, not only in the different roles where before you asked, is Mates for the boots on the ground worker, is it for the owner of the company, and that understanding it's for everyone, but also within that we have such a diverse group of workers. So how do we capture everyone's voices? And so this year we translated the survey into the 6 most commonly spoken languages in our industry, because we saw that could be a real barrier to workers being able to share their voice and share their experience. And we also did things like utilised QR codes that you could scan on your phone so that you could use text-to-speech if you had, low literacy. So I think that really helped us, and we accessed a really diverse range of workers' voices, which is incredible. That's what it's all about. It's the bread and butter. It's what we want. So absolutely stoked with the response this year.
Great. And what were some of the key findings from the survey?
The key findings in terms of the well-being of our workers, it's really interesting. So you've got 60% plus saying that they absolutely love the work that they do. And we hear that all the time. The construction industry is an awesome industry, but the mental well-being of workers due to those key stresses, that's where Mates comes in. So we heard that of those 2,143, yes, I know the exact number, workers who completed it, 136 had serious thoughts about suicide, made plans or attempted. We know that 1 in 5 said that the last 12 months had been among the most difficult times of their life. And when we look to those external factors James alluded to at the beginning around your cost of living crisis, now recession, your extreme weather events coming off the back of COVID, there's a lot going on at the moment. And mental health came through really strongly, with 1 in 4 saying mental health is a concern for them and they want that support.
Thanks, Lauren. James, I guess you're the person or one of the representatives of Mates that gets to experience that research at a very personal basis when you're connecting with people on site. Could you maybe share some examples of how you interact with teams on site and how you can assist in these kind of challenges?
Yeah, absolutely. I think what Lauren spoke to there is exactly a lot of what we are picking up as those field officers. I'm one of 14 currently nationwide who has a portfolio of sites and offices that I look after as well as project. And what stands out to me always above everything else, not only the builds that we're a part of or the program that we are applying or implementing, is the people. Those champions that I meet on site are the ones that always ignite hope within myself, and the ones that I've been very lucky to meet over the years. I admire them first and foremost. Above all else, the work ethic that they have to not only encounter us and carry our message and build the suicide safer community within their sites and embrace us and organise that time and space for us to be able to not only deliver our training but welcome us onto their builds to walk through and see how they're progressing, to keep us updated with what is going on, what are the ebbs and flows, what are the stresses, what are the high and low points of not only their team but the industry itself. But got to acknowledge too as well that our industry, it can be a hard one to be a part of at times, and whilst being on site every day, we do hear a lot of those pressures that Lauren and I have mentioned, especially financial right now is number one. But also there's just the pressures of life as well. The pressures of life that don't really stop when we do come to work. And with our industry, whilst we'd like to be able to kind of put them into our toolbox and lock them into our car and then go to work on site, it's not necessarily the case. So with all of these macro, I guess, challenges within our industry and these micro challenges we all carry individually, can often see this stack up very, very quickly. And whilst it is a tough time right now, especially regarding our industry right now, even just being able to talk about our message, talk about, or acknowledge really that it is what it is and call a spade, that these are tough times that we are walking through, and that we need to be aware of that rather than trying to shoulder or try to hide under the rug what is happening and what stresses do exist. Acknowledgement is key to what I've seen from those champions and from those carriers of our message, to those connectors that I mentioned, to those assist people that I've been lucky to engage with. But also, more than ever, I've noticed that with a lot of solidarity within companies banding together and looking after each other, rather than the opposite, what I would have, I guess, been perceived to experience, seeing lots of these little communities and experiencing them firsthand by being a field officer is gratifying. It's amazing to see that resilience be present within industry and in lieu of such of the times that we are going through right now.
Sure, it's such important work, and it's not a reputation we want to be the industry with the highest suicide rate. So I know you guys are making a big dent in it, and I think it's easy for us to do the whole, we're doing better and we're making progress. Lauren, I understand you actually have insights around what results you get when people or organisations participate in the Mates in Construction training. Could you share some of those with us?
When anyone goes through a Mates training, they complete a pre and post evaluation, which helps us to see if there's any shifts in attitudes or helping behaviours. And when we look at 66,000 of those evaluations from trainings that we've done, we see that in terms of destigmatising suicide, 92% of workers are more open to talking about suicide post-trainings. We know that over 90% of workers who've done a Mates training would know how to connect their workmate to help if they were struggling or thinking about suicide. And 94% of workers would know where to go for help if they themselves were struggling. So just incredible, reinforces what we do, why we do it, creating that real peer support network on the ground. Just fantastic.
They are some very, very impressive results. I'm curious at a couple of levels that I'd like to explore. One might be, I haven't yet done any Mates training in my organisation. How do I connect with Mates? What would be my first step? How would I get going?
Yeah, well, it's simple as reaching out to us via our website. We'll come through to our inquiry line. We can get back to you on how that would be organised. We've got our 0800 number, 0800 111 315. Give us a call around where you're at, what you would require, what those needs would be, where you're located, how we can plan and organise together. And we've also got to consider, I talked about numbers a little bit earlier when I mentioned training, but especially in regards to being here with Master Builders, a lot of your businesses are a lot smaller. They're going to be, impacted by some of those stresses that we mentioned. That it's important to even get in touch through their membership to register Master Builders. I know we hold a lot of events nationwide. We often work hand in hand with ourselves, so it's also another great touch point to be able to, again, break down that stigma.
And James, what about the scenario that I've recognised someone on my team maybe is acting a bit differently? They, my assessment might be that they don't seem to be in such a great space. Maybe that we're seeing some different behaviour from them. I haven't yet done my Mates training. What might I do to maybe help in that situation immediately? I
always like to say, especially around like that connected training I mentioned earlier, around asking that question, being clear, direct and honest. Whilst that is a formal qualification within that training, I'd quite like to elaborate and say that we do formally train, but connectors are found. If you have noticed this invitation from somebody, most likely you're the person to ask them that question, even if it is, hey bro, I've noticed, usually you're always really onto it with work. In the last 2 weeks, a few things have been slipping, listing those examples of what you've seen, maybe even heard. You've heard a few sentences been flying around that would maybe raise your alertness, bringing it to that person that you've noticed. Ask them, are they okay? Using those examples that you've seen, heard or felt to investigate further, because they could actually be fine. You might have just had those that alertness raised and they are fine because they're just busy on that day, or they have been busy for a couple of weeks straight and they're stressed. But now you know, and you've clarified. If they do feel comfortable to share with you, that discussion can be had and you can move forward. However, they might say that they're fine and not discuss with you then, but it might prompt them to later on down the line either come back to yourself because you did notice and you did make that first step, or they might even talk to somebody else. And that's what I would encourage. To make that first step, check in with somebody, because it could be the conversation that does need to be have at that moment. Someone who's potentially suffering in silence, those little words that you say to them absolutely could be the words that they need to hear right at that moment. Just like honey to the soul, we always say.
Sure. Thanks, James. Appreciate that. And Lauren, I guess as a researcher, you're always curious for more insights and more data. What's something you'd really like deeper insight into that maybe you don't have to the level you'd like right now?
Oh, I like that question. Always curious. Something that we're looking into at the moment is digging into the subgroups of workers to understand the stresses for those different groups. For example, if you've got groups of apprentices, migrant workers, female construction industry workers, supervision level, what are the different stresses those groups are facing as Mates looks to maybe expand what we do in time or do those targeted programs. And I also think that longitudinal data, which is where we go back to our participants at a later date and see what is this training looking like on the ground. Are people coming to you as a connector seeking that support? What are those barriers to implementing that learning? How can we help? Now that Mates has been around for around 5 years, we can start really digging into that, which is, as a nerdy researcher, man, that's really exciting.
I love it. I could see the energy and enthusiasm around that. That's brilliant. I just want to really highlight that Mates does operate a support line. The number you mentioned it earlier, James, was 0800 111 315. Team, is that number manned 24/7? When can people access that number?
Yeah, it's manned by ourselves during our working hours. After our working hours, it is manned by a national crisis line. During those working hours, it will come through to one of our other field officers or case managers who will be able to receive that request, whether it be a conversation, an inquiry, or even if it is someone, that example you mentioned earlier about maybe something that you're worried about, could be a discussion had about even someone externally.
Fantastic. So just to repeat that number, 0800 111 315. So if anyone is feeling like in a place that they might need some support, please give their number a call. And equally, as you suggest, James, if you're someone who thinks someone in your team might need some support, do that. Would also encourage all our listeners, if you haven't already had Mates in Construction training in your organisation, get that organised. Go along to mates.net.nz and you'll find the lots of info on how Mates can help your organisation. And I think what's the saying about the best time to plant trees yesterday, and the very next best time is today. And so when it comes to awareness around our mental health training, it's great to do it before it's needed. So even if you think, hey, everyone on my team is sweet, we're all good, no one's got any challenges here, everyone's happy, that would be the perfect time to kick off some training so that you're all prepared come should a situation arise in the future. Closing thoughts, is there a key message you'd like to share before we wrap the podcast?
Mine is, if Mates is doing any research, share your voice, because the more voices we hear, the more insight we have, and the more that informs what we do, because it's all about what we do coming from industry need, coming from our workers, and being able to share what we find on a platform like this is epic, and just appreciate it so much.
Oh, absolutely. I love what you said there, Lauren. Be heard. Model that vulnerability that you do have. We all go through things in life. We all go through stresses, ups, downs, lefts, right, and everything in between. But by modelling that vulnerability throughout your day-to-day actions, from wherever you sit, wherever any organisation or job that you have, you can encourage this culture change to foster not only breaking down this stigma of this thing we call suicide, of stress, of self-expression, but also let those know who do need to be heard that they can be listened to, that you are someone that can be talked to. Even just a quick, we call it in the office, that quick vibe check in the morning where you just say, how's someone going? You say, call them by their name. Ask them how that weekend was, like we started this podcast with. That is an absolutely amazing win. And we stack up those little wins.
It's brilliant. Look, you guys are really doing some incredible work. the whole organization, thank you for the effort and passion you guys bring to this. You're really making an incredible difference, and there's probably not too many people we get to have on the podcast that we say you're literally saving lives every day, but Mates in Construction is. So thank you for the incredible work you do. Now we know that this is a very serious topic, that if someone has experienced extreme mental health challenges, they need to get the right support, which Mates can help with. But also sometimes we're having just a bit of a down day and we need a smile and a laugh. Is either of you got a good joke you could share to us with might bring a smile to our face on the way through?
Oh, geez. I've got it's a bit of a stand-up style joke, because we meet so many people. One of the guys I met on site, he's an absolute character. He's a gateman. If you're familiar with that sort of role, you allow the deliveries to make sure that everything is safe going in and out of sight. And gatemen are usually quite personalities. This gateman, every time I'd see him, he walks as if he was carrying like 2 shopping bags either side of him, like just chest flared out. And he says the same thing every time I'd ask him how he was going. Same answer every single time. I'm like, oh, hey brother, hey Honey, how's it going? And he'd go, grateful, and stare off into the distance, like Simba in The Lion King. And then I'd go to not shake his hand, he'd always offer a fist, and we'd fist bump, and then he'd like convulse, almost like he was having a seizure. His arms would flare out the side, and he'd go, jellyfish, brother. And that's my joke, is that it's funny to laugh at, but that is a laugh that warms my heart because it's a joy, and those are the characters, other people.
Approachable. Love that, James. Great way to wrap the podcast. Thanks again for you guys' contribution and joining the podcast today, James and Lauren. And a quick shout out to a couple of other people at Mates that have helped make this podcasting possible, being Praneel and James Lee. Thank you guys for your contribution as well. It's been a pleasure, and keep that good work up.
Sure, well, thank you so much for having us.
Thanks, Ryan.
Pleasure.